The Center of Excellence for Women's Health led a project with the goal of creating resources about women's chronic pain and prescription opioid use that reflect women's experiences.
In this video, we provide a brief overview to this project based on information that has been gathered both from the research evidence and from interviews with women who both experience chronic pain and have used prescription opioids for pain management. In our research at the center, we look closely at how healthcare providers and systems can be responsive to women's experiences of health issues, and how healthcare providers can best share information and provide support for change as women make decisions about their own health and the health of their families.
I'm Lindsay. I'm the research manager at the Center of Excellence for Women's Health. I have also lived with chronic pain my entire life, but in the past 10 years, it's become a larger feature in my life as I navigate both migraines and endometriosis.
I'm Liv, and I'm a researcher at the Center of Excellence for Women's Health. I'm also someone who has lived with chronic pain. I had a late diagnosis of severe scoliosis in 2009 that led to years of bracing, multiple surgeries, broken hardware, and pain. In 2018, I was also diagnosed with fibromyalgia.
Our lived experiences with chronic pain and navigating healthcare not only are part of why we are so interested in this work, but it also informs how we do this work as researchers. The findings of this study mirror our experiences, and this helps us share the information with you as healthcare providers and educators in ways that can continue to contribute to an informed, empowering conversation with your patients.
In this project, we made a concerted effort to capture the experiences of women living in BC, Yukon, and Northwest Territories who are diverse in age, race, ethnicity, sexual orientation, pregnancy status, and experiences of violence. We heard their experiences with prescription opioids for pain management, with accessing their prescriptions, and with other complementary therapies in their pain management plan. We also looked to the literature from the last decade to see how women's experiences have been represented.
In this video, we will share the overarching learnings arising from this research that may be important to you, as providers and educators, to know as you interact with women with chronic pain who are using opioids for pain management or who are interested in prescription opioids as part of a pain management plan.
Generally, women describe prescription opioid use as making their pain more manageable. Their prescriptions help them return to their day-to-day activities, such as working, exercising, and seeing family. They describe that even just knowing they had access to a prescribed opioid, regardless of if they used it regularly, improved their overall well-being because it meant they had an option to get through their worst pain days if their other pain management strategies didn't work.
Something we see in the media or hear anecdotally is that women exaggerate their pain to get a prescription. While one of the 49 included studies we found identified similar behavior, it wasn't reflected in our interviews or in the rest of the research we came across. More commonly, women expressed that they were leery of taking prescription opioids out of fear of dependence or addiction, and so they created plans for themselves and took it with caution only after trying a range of other pain management techniques. In the literature, we found that women taking opioids were likely to report more comorbidities than men, and that postmenopausal women with histories of prescription opioid use were more likely to have worse pain scores, increases in non pain related medical conditions, lower physical functioning capabilities, higher BMI, and depression diagnoses. Perhaps the most serious side effects named in the literature were related to withdrawal, particularly when prescriptions were not renewed and women were forced to withdraw without planning in place to slowly taper off prescribed opioids.
In the literature and in the interviews, women reported that they did not feel listened to when they tried to discuss pain management. They reported receiving minimal guidance on benefits and risks, the importance of prescription adherence, and side effects.
In the interviews, we saw the effects of this lack of discussion in one of two ways. Some women frankly did not know what they were being prescribed, and conversely, others found the need to create detailed care charts for themselves as a form of self advocacy to really capture everything they've been prescribed over time and the dosage they took every day. We know that pharmacological approaches are only one part of the story. Many women walked us through comprehensive care plans they had, including heat therapy, exercise, dietary and lifestyle changes, acupuncture, physiotherapy, chiropractor, psychotherapy, and massage. And in the interviews, despite women recognizing that these were really important to reducing their pain, they also expressed how many of these are expensive and not always financially accessible compared to prescribed opioids. And for some, without having a prescription for effective pain relief, they're driven to use alcohol and other substances, increasing the risk of harm and dependency.
Ultimately, women expressed that they had more trust in their healthcare team and experienced more success in their pain reduction when they were included respectfully in care planning and when they had a diverse and comprehensive care plan that was inclusive of different lifestyle allied health, clinical, mental emotional health, and pharmacological strategies.
Most women that we interviewed expressed how, at least at one point in their pain management journey, they felt as though they were seen as drug seeking, and that really impacted the care that they received. The pressure on providers to limit prescriptions has impacted the ability for women with chronic pain to access opioids for pain management. Women mention the difficulties of tapering off their prescribed opioids, sometimes without adequate consideration for individual medical history, pain level, or functional limitations. One of the most profound themes, though, throughout this was hearing how insistent women were about wanting to know more, and yet how they felt disenfranchised or not privy to information about their own care. For instance, when we were recruiting women for in person interviews, some women didn't even know that they were being prescribed opioids.
Women express that they want collaborative relationships built on trust and respect. They want their pain to be investigated. They want to have diverse pain management strategies, and they do not want to be stigmatized if prescription opioids are part of their care.
And so we hope this research can help guide healthcare practitioners to work in collaboration with patients, recognizing that they're interested and able to manage their pain in a way that leads to improved well being.